Hello everyone. In this presentation, I am going to discuss about direct filling gold restorations. I will be discussing only the essential contents which are needed for a dental students to study and remember. If you are a dental student, kindly consider subscribing to my YouTube channel, Smart Dentistry Student Zone. I will make videos that will be useful for your academic purpose. Gold is a material which has been used in dentistry as long as the history of dentistry goes. It is one of the oldest of the material which have got a lot of applications in dentistry. There are two types of golds which are used in dentistry. One is the cast gold and other is the direct filling gold. In this presentation, we are not going to discuss about the cast gold restorations and we will be discussing only about the direct filling gold restorations. Direct filling gold are the restorative materials that are manufactured for doing the restorations directly into the prepared cavity. Gold is considered to be one of the superior material among all other restorative materials. It's because of their superior biocompatibility, its longevity. Gold can be considered as a restoration which will last for a lifetime. It can be considered as the most permanent restorative material ever used in dentistry. Direct filling gold restorations gives the greatest marginal integrity among all other restorative materials. It has immense resistance against tarnish and corrosion in the oral environment. And so we can say that gold restoration can last for a lifetime and it is the most malleable and ductile of all the materials available. Direct filling gold restorations have very limited indications. It can be used only for small incipient carious lesions, class 1 lesions in premolar teeth and other accessible developmental pits, especially the buccal pits of mandibular molars, class 5 carious lesions. Even today, class 5 carious lesions, direct filling gold is one of the ideal indication. Then small class 3 lesions in maxillary and mandibular anterior teeth which are not aesthetically visible to appearance. Class 2 lesions in premolar teeth when the lesion is small enough to allow a conservative cavity preparation, and class 2 lesions on the mesial proximal surface of molars. And whenever there are some erosive lesions, we can go for direct filling gold restorations. And it is another very important indications for direct filling gold restoration is to repair the faulty margins of the restorations. But whenever we are choosing direct filling gold restorations as the material of choice, we should take some precautions like teeth with no enamel creasing and micro cracks should be selected. Carious lesions in which enamel margins can be located on sound tooth structure only should be selected. If the carious lesion extends quite subgingivally, we may have to go for alternative materials or cast metal restorations. There are some contraindications for doing direct filling gold restorations that includes in handicapped or elderly or very young patients who cannot sit for a longer appointment, because doing a direct filling gold restoration will consume a lot of time, and physiologically unsound or unhealthy patients and teeth with large pulp chamber, direct filling gold is not an indication. Periodontally weakened tooth, large carious lesions, as I mentioned before, direct filling gold is indicated only for small carious lesions. Chalky or melted enamel could contraindicate the use of gold, and if the patient is economically not affordable, because compared to most other restorative materials, gold restorations can be more expensive. If there is a high caries index of the patient, or if there are some hypoplastic areas or aesthetics is of a major concern, then direct filling gold is not indicated. Direct filling gold restorations can be performed only in locations which can be isolated well. In high stress bearing areas, it is contraindicated. In accessible areas, it is contraindicated. And whenever there are underdeveloped roots, the direct filling gold restorations are contraindicated. The direct filling gold restoration have so many advantages. That includes one, it is a permanent restorative material. It does not tarnish or corrode in the oral cavity. The coefficient of thermal expansion of direct filling gold will match close to that of the tooth, and there will be no tooth discoloration. If you take amalgam will cause tooth discoloration, but gold will never cause tooth discoloration. It adapts well to the cavity wall, so there will be no marginal leakage. There is no need for a cementing or a bonding material as in case of composite restorations. It is very easy to polish because it is a very soft material, and the polished surface of gold is plaque repulsive. So the chances for the secondary caries to occur is very less, and it has a very good wear resistant. It can withstand compressive forces even in thin layers, hence deeper cavity preparations is not required, and it has a very good response to the adjacent gingival tissues. There are few disadvantages for direct filling gold restorations. They are direct filling gold, it is a non-tooth colored restoration, so it cannot be used in aesthetically visible areas. It is more expensive, and doing the restoration can cause some discomfort to the patient, and it can be used only for small cavity preparations. The manipulation and restorative procedure is quite difficult, and it needs a long learning curve, and it is a very technique sensitive restorative material to use, and also the high condensation force may injure the tooth and or the supporting structures. All this being said, let's move on to the classifications for direct filling gold. I will be covering only about two classifications, the classification given by Skinner's or the Phillips, and also the classification given by Marsuk. According to Skinner's, direct filling gold can be categorized into three groups. One, the gold foil or the fibrous gold. Second, the electrolytic precipitate. And third, the powdered gold. Gold foil or fibrous gold can be further subdivided into sheets, ropes, cylinders, laminated foil and platinized foil, and the sheet can be cohesive or non-cohesive. We will be seeing about all these types of direct filling gold in the coming session. Then electrolytic precipitate is subdivided into the matte gold, the matte foil, and the gold calcium alloy, are also called as the electroalloy. The powdered gold is categorized into an encapsulated gold powder. While the Marsuk has classified direct filling gold into two categories, the gold foil and the precipitated gold. The precipitated gold consists of the electrolytic precipitate and also the powdered gold. The gold foil is subdivided into the plain gold foil, the corrugated gold foil, the platinum gold foil and the laminated gold foil. The precipitated gold is subdivided into powdered gold and the matte gold. Let's see about the forms of the direct filling gold. There are so many different forms of direct filling golds which are available. In this presentation, we will be seeing about the 10 types of direct filling gold which is available in the market. The first one is the gold foil. It is the most popular and widely used type of direct filling gold material. Here the gold is taken, it is rolled and it is made into thin sheets, and it is supplied in the form of thin sheets of specific dimensions. It is available in the books of sheets separated by papers in between. The book contains 1/10 to 1/20 ounce of gold. The book of foil is marked and cut into small rectangles or squares, and each piece is tucked the corners, and it is made into a small cylinder or two different shapes, and this can be used for restoration. The next type of gold foil is the laminated gold foil. In the first step we have seen that it is a single sheet. But in case of laminated gold foil, we take 2 or 3 or more number of sheets and it is rolled together to make into a single thicker sheet, and then this sheet is cut into small pieces, rolled, made into cylinders, and it can be used for restorations. This is called as the laminated gold foil. Next comes the corrugated gold foil. For this technique, one sheet of paper is taken, and on top of that a sheet of gold foil is placed, and on top of that another sheet of paper is taken and the paper is lit. Once the paper burns off, it leaves a corrugated gold foil. This will have more retention while packing, and it will be very easy to work with. This is called as corrugated gold foil. Next comes the platinized gold foil. It is something similar to that of laminated gold foil, but in case one sheet of gold foil is taken and top of that a layer of platinum foil is placed. On top of that another gold foil sheet is placed, and this is rolled together to make into a thicker sheet. This provides much stronger restorations compared to that of gold foil restorations. Next comes the matte gold restoration. It is a type of electrolytic precipitate which is taken, which is pressed together, and it is made into the different shapes like cylinders, cones, or depending upon the type of the use, and it is supplied. It is a type of direct filling gold which is more spongy in appearance, and while doing the restoration it adapts well to the cavity walls. Matte gold is used for building the internal bulk of the restoration. The next material is the matte foil. A matte foil is a type of direct filling gold in which one layer of direct filling gold foil is placed, and top of that this electrolytic precipitate of gold is placed. On top of that another layer of gold foil is placed, and this is rolled together to make the matte foil. The advantage of matte foil is that the electrolytic precipitate, which is a spongy material with irregular surface, is placed inside and it is covered by a smooth finish of gold foil. It also has some other advantages, like it is very easy to place while doing the restoration. There will be a reduction in the placement time, especially in case of large cavities. The disadvantage of matte foil is that there is a greater tendency for voids to appear while doing the restorations. The next type of the direct filling gold is the electroalloy. It is a combination of gold with calcium. This is much stronger compared to that of gold alone. And next comes the stop of gold. It is available in the market as stop of gold, and it is available since 1989. It has a biggest advantage that the final restoration will have a great density compared to any other forms of granular gold, and there is a 50% increase in shear strength when compared to gold foil. There is something called EZ gold. It is a blend of atomized and precipitated powder embedded in a wax-like organic matrix. While doing the restoration, this EZ gold is taken and it is heated. Once it is heated, the matrix, which is the wax matrix, will get burned off, leaving only the pure gold, which is then packed into the cavity. It is often indicated for small class 1 and class 5 lesions. And the last type of the gold that we will be seeing here today is the gold dent. It is a combination of powdered gold and gold foil. So as we have seen before, the matte foil, it is a matte gold wrapped in gold foil, but it's a gold dent which is a powdered gold which is wrapped in gold foil. The ratio is 95% of powder to 5% of foil. So it is provided in the cohesive form, and it has the advantage that it envelops and holds the powdered particle during condensation, which makes the handling of this restoration very easy. It can be used in almost all restorative purposes. Now let's move on and understand what is called as cold welding. Direct filling gold restoration is possible only because of this cold welding. So it is essential to understand what is this cold welding. All metals have a property. When they are heated to high temperature, they will become soft and they will start melting. Once it starts melting, two pieces of the metal can be fused together into a single piece. This procedure is called as welding. But what is cold welding? This can be done in the room temperature with the help of pure gold. When atomically pure gold, that is atomically it has to be almost 100% pure without any surface contamination, and if they are pressed together under force in room temperature, the pieces of gold can fuse together into a single one. Direct filling gold restoration is possible only because of this property of gold. No other restorative material or any other metal which is used in dentistry has the property of cold welding. Next, let's see what is called as a cohesive, semi-cohesive and non-cohesive gold. In some textbook or some authors prefer to use the words semi-cohesive and non-cohesive interchangeably. As I mentioned before, gold in pure form can be fused together under pressure in the room temperature. For this to happen, there is a mandatory requirement. The surface of the gold should be free of any contamination. So there is a type of gold which is called as a cohesive gold, where this material is supplied to the dentist without any surface contamination by the manufacturer. So the dentist take the gold, cut into pieces and it is heated and it is placed in the cavity so that the gold pieces will fuse together and the restoration can be made. This is called as the cohesive gold. Cohesive gold are free of surface contaminations. Next comes the semi-cohesive gold. In the semi-cohesive gold, the surface of the gold is treated with a easily volatile gas like ammonia. So this ammonia gas will prevent any other contaminants to get adsorbed to the surface of the gold. Once the dentist is ready to restore the cavity, he will take a small pellet of this semi-cohesive gold and show it over the flame or heat it, thus removing the adsorbed ammonia gas from the surface, which is easily volatile and it can be easily removed, so that the surface will become pure again and which will become cohesive. So semi-cohesive gold, it is supplied with a layering of ammonia gas. Once the dentist takes and it is heated off, the ammonia gas will get evaporated and the material can be used for restoration. And there is a type of gold which is called as the non-cohesive gold. Here, the surface of the gold is contaminated permanently with materials like sulfur, iron or phosphorus. This cannot be used for direct filling gold restorations because this surface contaminants are there, so there will be no cold welding taking place. But according to some authors, the semi-cohesive gold is also called as the non-cohesive gold. So some authors calls the ammonia treated gold as a non-cohesive gold. Now let's move on to the tooth preparation for direct filling gold. In this presentation, I am not going to cover in detail about the tooth preparation for direct filling gold. We will just see a small gist about the fundamentals of tooth preparation, which are mandatory and essential to be understood by a dental student. The outline form of the tooth preparation should be smooth, that is, it should not be ragged, and it should be well placed in sound tooth structure, as with most other restorative materials tooth preparation. The resistant form is provided by a flat pulpal floor and well supported by the dentine. That is, the enamel should be well supported by the dentine. The retention form is provided by the almost parallel walls or by converging walls. The internal line angles and the point angles should be sharp. Apart from any other restorative material used in dentistry, only direct filling gold tooth preparation we will prepare with a sharp internal line and point angle. For most other restorative materials, we will prepare a definitive or a rounded internal line and point angle. Adequate depth should be provided for retention. The tooth preparation should provide a suitable access, isolation and instrumentation for an efficient restoration with direct filling gold. So in short, 3 points have to be kept in mind while studying about the tooth preparation for direct filling gold. The cavo surface margin should have a 45-degree beveled margin. Walls should be parallel or almost parallel, or it can be a slight occlusal convergence, and the internal line and point angle should be sharp. If you are moving on to the class 3 tooth preparation for direct filling gold, the outline form resembles a triangle with the base of the triangle towards the cervical margin and the apex of the triangle towards the incisal edge. One of the widely indicated use for direct filling gold is class 5 caries. We can notice a sharp internal line angles and a sharp pointed corners of the tooth preparation when we make for direct filling gold. Now let's move on to the restorative procedure for direct filling gold. Basically, we have to understand 3 steps while doing a restorative procedure. First, we have to degas or prepare the direct filling gold material to be ready for restoration. Then we have to understand the principle of compaction and a little about the gold condensers. Then we have to move on to the steps in the restorative procedures. Degassing is a procedure in which the surface contaminant like the ammonia gas or any other impurities which are present on the surface is removed by heating. The degassing or desorbing or heat treatment can be done by one among these three following techniques. That includes the open alcohol flame desorption, mica over a flame desorption, and the electric degassing. The open alcohol flame desorption is the most common type of degassing technique which is used for direct filling gold, in which a small pellet of direct filling gold is taken. It is shown over a open alcohol flame so that the surface impurity which is present will be removed, and once the gold turns red hot, it is said that it is ready to be restored. It can be then taken to the cavity and it can be used for the restoration. The next most common technique which is used is called the mica over a flame technique. In this technique, over a alcohol flame, a mica sheet is placed, and on top of this sheet, the small pellets of direct filling gold material is placed. The biggest advantage of this technique is there is no need to take each pellet and it to be heated. We can do bulk heating of the material or bulk annealing of this material. But the disadvantage is sometimes the gold pellets which are placed in close proximity can get stuck together and there can be unequal heating. The last technique for degassing is the electric degassing. In this technique, an electric heater controls the time and temperature, and the surface of the heater is divided into small compartments. So depending upon the requirement, the pieces of gold material is taken and it is kept over the heater, and once the approximate time is reached, it can be taken and directly it can be used for restoration. So it is a very convenient method and it does not need the help of an assistant. The disadvantage is if we are heating more material, we may not use all this material while doing the restoration. So it can lead to wastage. If we are taking more time for doing the restoration, some of the pieces of gold which are placed over the electric annealer may get over annealed and which may not be useful for doing the restoration. Again, it might get stuck to the other pieces, as all the pieces of gold is placed to the annealer in the beginning of the restoration itself. So the inability to select the annealed gold is a disadvantage, and the air current can affect the uniformity of the heat. Now let's see a little about the principles of compaction and a little about the compactor. The first and foremost important principle while doing a direct filling gold restoration is the first fragment have to be placed in corner of the cavity preparation, and the force of application should be around 45 degrees to the fragment placed. So the fragment is placed in the corner of the cavity preparation and at 45 degrees the force is applied. Once the first increment is well compacted, the next increment is placed on top of the first compacted increment and a 90-degree force is applied so that cold welding will take place and both the first and the second increments will get fused together. Once this is done, the further increments are added sequentially and each increment is well condensed. While doing the condensation of the second increment or the further increments, the tip of the condenser should overlap half of the old increment which is placed and half of the new increment which placed. For doing compaction or condensation of direct filling gold, the 4 different techniques can be used. That includes the hand instrument condensation, automatic hand malleting, electronic condensation, and pneumatic condensation. So in the first technique, with the help of the hand instruments or the hand condensers, the force is applied and it is compacted well within the cavity. Maybe a mallet is used in order to tap the direct filling gold material so that the cold welding can take place. So this is an easy technique and does not require any sophisticated instruments for compaction. In automatic hand malleting, the spring-loaded instrument is used. This equipment, once it is pressed hard over the increment of the direct filling gold, there will be a spring-loaded setup which will tap the direct filling gold and it will be condensed properly. In case of electronic condensation, there are electronic condensers available. The tip of these condensers can be changed and there will be different types of condenser tips are available. This can be placed on top of the increments, and once the equipment is activated, there will be the tip will move electronically and it will start compacting the direct filling gold. This is a very easy and this is a well controlled technique for doing direct filling gold compactions. The last technique is the pneumatic condensation, in which the compressed air is used for creating vibration and tip movements which can condense the direct filling gold material. Now let's move on to the steps in doing the restorative procedure for direct filling gold. It can be divided into the following stages: the buildup of the restoration, paving of the restoration, surface hardening, burnishing, margination, contouring, additional burnishing, finishing and polishing, and final burnishing. Let's see all these steps one by one. The first step in doing the restoration is the buildup of the restoration. In this first step, the bulk of the restoration is done and the entire cavity is restored. This consists of 3 sub-steps. The first one is the tie formation. So the tie formation is the placing a direct filling gold increment in one corner of the cavity, and following the line angle, the entire wall is filled. That is, from one corner of the tooth preparation to the other corner. Following the line angle, the restorative material is built up. So this will resemble a tie and this is called as a tie formation. Once this is completed, the next step is the banking of walls. The entire buccal wall is restored by adding small increments and banking towards that specific wall of the tooth preparation. So this is called banking of walls. So next comes the shoulder formation. In the similar fashion, the entire cavity is filled starting from one corner and extending towards the other corner, that is the opposite side. Material is placed over the buccal wall, next over the lingual wall, then the mesial and the distal wall, and the entire cavity is restored. So this technique of restoring direct filling gold is called as the shoulder formation. So by this, the entire cavity is almost filled with pieces of direct filling gold. The next step is called as the paving of the restoration. Basically, the paving of the restoration means it is over restoring the cavity preparation. So 1 to 2 millimeter of material is added on top of the restored cavity, extending 1 to 2 millimeters out of the cavo surface margin of the prepared cavity. So by doing this technique, we are adding more material over the corners and the cavo surface margins so that there will not be any marginal defects and the margins will get well compacted. So this procedure of adding more material and covering the cavo surface margin and extending the material 1 to 2 millimeter out of the prepared cavity is called as the paving of the restoration. The next step is called as surface hardening. Direct filling gold material, when compacted well, the density of the material towards the surface will increase. So with the help of the condensers and with other instruments, it is well compacted and it is well smoothened so that it will enhance the surface hardening of the material. This step is called as surface hardening. The next step is called the burnishing. In this step, with the help of gold burnishers from the restoration towards the margin of the cavity preparation, heavy forces are applied to burnish the direct filling gold material. This burnishing is very essential to establish a smooth surface. The next step is called as margination. Margination is a step in which the excess material which is present out of the cave surface margin is removed. Remember that in paving of the restoration, more material is added out of the cavity margins, but in case of margination, the excess material is removed after surface hardening and well burnishing. So this step is very essential in order to increase the density and a close adaptation of direct filling gold to the margin of the restoration. The next step is called as the contouring. In this step, the carving of the direct filling gold restoration is done and all the anatomic features resembling the tooth morphology is created. This can be done with the help of gold carvers. Next, if needed, additional burnishing is done after carving in order to remove any irregularities which are created by carving. Anatomic contour is established. Then rotary finishing and polishing can be done, which will provide a well smooth finished surface. Direct filling gold can maintain that luster which is created by this finishing and polishing procedure for a lifetime. Polished surface of the gold will repel plaque accumulation. And finally, after doing finishing and polishing, if needed, a final burnishing is done in order to create a well smooth margins, and if there are some irregularities, it will be removed by doing this final burnishing. So these are the steps in doing a direct filling gold restoration. At this stage, we can understand that direct filling gold is one among the wonderful restorative material used in dentistry, but still there is a drastic decline in the use of direct filling gold restoration at present in dentistry. This can be broadly put towards the three important factors. They are the patient factors, the operator factors, and the material factors. The patient factors include the high cost of the direct filling gold material, and then it is not a very comfortable restorative material to be experienced by the patient. It requires a extensive cavity preparation, a long chairside time, a long appointment duration. So most patients may not like doing a direct filling gold restoration. It might need an extra visit in case of time-consuming procedures are done or a complicated cavity preparation is needed, and it is not a tooth-colored restorative material. The problem of galvanic shock exists, and there is a fear among the patient exists about the tooth or the periodontal ligament damage because of the condensation force applied while doing direct filling gold restorations. The operator factors which leads to the decline of gold restorations are: it requires a very high skill by the operator, and most of the dentists and also the patients are more lured towards the cosmetic dentistry or the tooth colored appearance of the restorative materials, and it requires more chairside time. There can be a possible pulpal and a periodontal damage, possible damage to the enamel margins while doing compaction. It might get fractured off, and during degassing, extra care should be taken. Overheating or underheating will start leading to peeling of the direct filling gold restoration and failure of the restoration. And there is always a doubt or a suspicion about pill leavage. Pill leavage is a type of failure in direct filling gold restoration, which is the one increment of the gold may not well compacted to the other increment of the gold. So these two increments of the gold remained as two separate increments, and in clinical usage, one of this increment may get peeled off from the other, leading to loss of the restorative material. The material factors which are responsible for the decline of use includes the economy, because it's very expensive, the non-availability of the direct filling gold material. The availability by the manufacturer to the dentist is very limited, and it has a very high thermal conductivity. The high density of the gold alloys requires more gold material to be used even for small cavity preparation, and the softness of the pure gold limits its use to the large cavity preparations, and the color of the gold is not very aesthetic. and gold at present is not able to compete with the newer restorative materials, especially with that of composite and ceramic restorative materials. So I would like to conclude this presentation with a statement that no other material serves as a complete and a satisfactory substitute to direct filling gold restorations, because direct filling gold is a wonderful restorative material. But because of so many factors, the use of direct filling gold restoration in dentistry has declined drastically. So being dentist, it is our responsibility that we should have good knowledge and idea about direct filling gold restorations, and we should improvise this material and make it as a material of choice for the future generation of people. If this question is asked for the exam, then the following points have to be there in the answer sheet. First, there should be a small introduction about what is direct filling gold, and then we have to write about the indications for direct filling gold, its contraindications, the advantages and the disadvantages. Then the two classifications, the Phillips and also the Marzouk's classifications, which are quite simple, have to be written. Then the types of direct filling gold material, there we have to write in little detail about the gold foil, the laminated gold foil, platinized gold foil, corrugated gold foil, then the matte gold and the matte foil, then about the EZ gold, the stop of gold, golden and electroalloy. All these materials have to be explained in short. Then we have to explain about the cold welding, that is atomically pure gold when it is pressed together at room temperature. The fusion or the welding of the material will take place at room temperature, which is called as the cold welding. Then we have to talk a little about the cohesive, semi-cohesive and non-cohesive gold. Then a little about tooth preparation for direct filling gold, especially for class 1, class 3 and class 5. Next, we have to mention about the degassing procedure over the open alcohol flame, mica over the flame and the electric degassing. Then we have to write about the principles of compaction and condensation techniques, the hand condensers, automatic hand malleting, electronic and pneumatic malleting. All these have to be explained in short. Then the steps in doing the restorative procedure, there are 9 steps. All these 9 steps have to be written, and if possible some pictures can be drawn. So the two places where we can draw pictures are one, the tooth preparation, and next is the steps in doing the restoration. Then we have to write about the patient, the operator and the material factors which led to the decline of direct filling gold restorations, followed by a conclusion and references. While writing the references, I would recommend you all to write the Phillips Science of Dental Materials and Marzouk as the major references, and even we can include Studvent as a third reference if needed. I hope this presentation is useful for all of you. This is a very important topic, and stay tuned. I will come up with more videos and more presentations which will be helpful for each and every dental students. Thank you for watching. Have a nice day.